What happens at 30 weeks pregnant?
You realize that you only have 10 more weeks, plus or minus 2 weeks. Then you start wondering if every set of Braxton Hicks practice contractions is the real thing.
I've already been told I have the perfect excuse if I ever get pulled over for speeding. What is going on with the kid?
The kid is around 3 pounds in weight, and the kid will start gaining half a pound a week per week, probably until delivery date.
I do not care about the weight as much as the size of the head. If he takes after his father in that regard, I'll have to have a C-section.
Try not to gain too much weight yourself, because it raises the risk of complications. But yes, right now the baby is getting all those wrinkles that make people much smarter than the average bear.
You mean chimp?
Whatever. And the kid's gaining the new layer of fat that makes them look like a normal little cherub, and the body hair that they developed around month 5 is disappearing.
Which I would also say he inherited from his father.
The biggest developmental milestone inside the kid per se is the bone marrow. The kid is now making his own red blood cells, instead of the spleen doing that.
I did not know the spleen did anything except getting mistaken for an appendix.
The kid's head is typically pressing against the bladder, unless the kid has not flipped head down yet. That tends to make you need to pee a lot.
It is as bad as it was when I was first pregnant.
If the kid has not flipped head down, this is the time to do those inversion exercises and other positions that give the kid more space to turn.
Yoga is not a good idea right now.
I'm talking about moves like a sideline release and forward-leaning inversion. You can also do a standing sacral release, which essentially makes the ligaments around the uterus relax so that the kid has more flexibility.
I'm losing my flexibility as is.
I know you're tired, but keep walking and getting low-impact exercise. The rocking motion of walking keeps the kid calm and helps him shift downward for an easier delivery.
I've heard of people walking around the ward to speed up the delivery.
You'll probably want to buy a nursing bra.
I've already had to get a maternity bra, my breasts have gotten so big.
The breasts usually get tender about now, and you may find that they leak anytime someone else's kid cries.
Just a precursor to what happens when my kid cries.
And you'll get properly trained to react to that by the time the kid is home from the hospital.